A milestone today at Baystate Medical Center. For the second day in a row, there are 0 COVID-19 patients in the intensive care unit.
Beth Ward sat down with the president of Baystate Health earlier today to talk about that, where we are as we head into the fall, and his take on the CDC's request that all states be ready to distribute a vaccine by late October. And Beth joins us now live with the latest. Beth?
Chris and Jordan, we sat down one-on-one with Dr. Mark Keroack on the grounds of Baystate. We covered a lot of ground, starting with that CDC mandate that states get ready to distribute a vaccine. The CDC telling public health officials across the U.S. to prepare to distribute a potential coronavirus vaccine as soon as late October.
That's awfully fast. That would be world record fast. It usually takes years and years to develop a vaccine.
Sitting outside on the Baystate campus, Baystate Health President Mark Keroack says safety trials are critical.
For me, there really ought to be a very high bar. That is to say, if you're going to give this to a perfectly healthy person who could stay safe from COVID just by wearing a mask and washing their hands, you should be really, really sure that it's extremely safe.
A process he says can't be rushed and cannot be political.
The idea that we would rush it in to production, to fit a particular political cycle or something is just contrary to all good practice, and I really would discourage that.
Dr. Keroack tells Western Mass News he's concerned about the recent actions by the CDC, perceived by some to be political in nature.
We've relied on the CDC as the definitive source of scientific truth, and to see it become politicized is very worrisome.
No stranger to infectious disease, his specialty for 20 years.
I was a foot soldier in the war on AIDS back in the 1980s and 90s, and so the idea of being afraid of an unknown illness that's, lethal was something I had been through before.
But this virus, he says, is unlike any other.
The thing that was really frightening about this disease was how fast it moved. It was completely unforgiving. If you made one little slip up, then all of a sudden you'd have dozens of cases on your hands.
However, Baystate has come a long way since March.
When things first started, this disease exploded. We went from 10 to 180 cases and in the hospital, and 0 to 40 in the ICU in about 3 weeks. And we nearly filled the hospital all with one disease.
Now a milestone since the hospital's peak in April.
Today we have only 13 cases, all at Baystate Medical Center. And for the first time in a long time, we've got nobody in our intensive care unit, which is really great.
However, the search for personal protective equipment, those PPEs, still a 24/7 operation.
We continue to work the phones day and night because it's a competition of one state versus another.
It's still that way?
It's still that way. Yeah, because remember, there are 40,000 new cases a day and 900 deaths a day in the United States. Now that's down a little from where it was earlier in the summer, but that's an amazing rate.
Keeping the numbers headed in the right direction as we head into fall is a big concern, particularly, he says, as college kids head back to school.
The schools have reasonable guidelines in place, but all it takes is a few, knuckleheads to go have a party on an off-site location, and you have another little brush fire going on.
Dr. Keroack says local school districts K through 12 are doing a thoughtful job and agrees with a remote or hybrid approach to start the school year and reevaluating in a month or so. Meantime, inside of Baystate, 2 floors remain as designated COVID floors.
There are 2 units that have only COVID patients on them, and most of their beds are empty, right, because we have only 13 in the whole hospital, but the state requires us to keep a certain amount of surge capacity available in case things heat up again.
As we head into the holiday weekend, he says he knows personally just how hard it is to stay the course.
We're heading into the Labor Day weekend, and my wife and I were talking yesterday about, wouldn't it be nice to go to Boston or go to New York or whatever, but maybe we shouldn't do that.
He's asking everyone, as hard as it may be, to keep up with social distancing to keep the numbers down. Dr. Keroack also says while he doesn't have a crystal ball, since most are wearing masks and social distancing, he predicts a quiet flu season. Fingers crossed for that. Live in the studio, Beth Ward, Western Mass News.